Hey guys, I'm Ryan Goodkin, and today we're going to talk about just hormonal imbalances. So some of the just basic general advice I like to give people, and it's actually sometimes really hard because ideally I would like for people to understand and know this information in their early teens. So for the parents, hormonal imbalances really start to strike in sort of your later 20s and your 30s and so on and so forth. And of course we're all familiar with menopause, which typically happens in late 40s, early 50s. But starting in the teens, after going through and starting puberty and going through puberty, it would be ideally a good time to get baseline. Thinking of the concept that patients or people are N of one, right? They are a very unique individual. So to get your labs done early and often, so like every 5 years, and you can track and you can trend and you can see where you are. What were you when you were 20 years old, 25, 30 years old, when your levels were basically optimal? And then when you get into your 30s, 40s, and 50s, and your hormones can either be imbalanced or just declining with age, there could be some other factors at play that are causing hormonal imbalances. And so it'd be nice to have all that lab work to refer back to identify sort of what is optimal. But when you do start feeling things that are just not normal, you just don't have the vigor, right? You don't have the vitality, and you're fatigued, you're just tired often. Maybe you don't have the sex drive or the libido that you once had. There could be physical signs, just inability to keep on lean muscle or hair thinning. So different things of that nature. Night sweats, of course, is really common. The vasomotor symptoms in menopause and perimenopause. So when that does occur, though, I think it's important to seek out a provider. That's the time when you want to find somebody that's very well trained in this space. I typically recommend somebody in the functional medicine space. IFM is the Institute of Functional Medicine. They do have a database. It's a good place to start to look for a provider. You can search locally. I would ask for referrals from friends and family. Even speak to other people. If you're in the gym, speak to some of those people and find out what they're dealing with. It's a very common thing. And utilizing BHRT, which is bioidentical hormone replacement therapy, is an option. And it's a growing option. And the risk-benefit should be analyzed, and in many cases it's a very dramatic turnaround for people that choose to go on hormone therapy. But there are risks, of course, and those should be discussed and very well understood with your provider. As far as other ways to prevent hormone imbalances, again, maintaining ideal body weight is critical. And how do you do that? Really focus on those pillars of health. Right? You want to focus on sleep, stress, socialization, your nutrition, your exercise. It's all of those things, staying hydrated and just leading a balanced life. And recognize that we all go through changes, and there's difference between men and women. There's significant differences there, but at the end of the day, focus on your general health. And if you adhere to some of those pillars of health, and you let your doctor know and speak to them about any changes that you're seeing, then ultimately I think you'll have a pretty good understanding of where you stand with hormones. And with testing, testing is important. There's a pretty thorough testing that can be done. Most practitioners, just in the general setting, are not doing a full panel of hormone testing. Obviously, you're mostly looking at the sex hormones. So that's your androgens, your testosterone. They're looking at your estrogens, your progesterones. They're really looking for the full balance of hormones. And there's many other hormones at play as well that they should be analyzing to figure out exactly what your imbalances are. Sometimes people ask if there's genetic factors at play. Typically not exactly as it relates specifically to a hormone level, but certainly it can in lifestyle. And some of those factors can, of course, contribute to hormonal imbalances. Please like and subscribe to my channel @RyanLiveGood. Thank you and be well.